also just to say well done for the work that you're doing. One of the best things that we can do for ourselves is gaining awareness, and this program of yours does that in fact very well. So thank you very much and well done. Now to go to you, to answer your question, cervical cancer is one of the most preventable cancers because of three main reasons. The first one is that we actually know the cause of the cancer. In a lot of cancers, we have risk factors, we have suspected causes, but with cervical cancer, we do know the cause. The second thing about that is that there is a pre-malignant or pre-cancerous stage of the disease that can be detected long before the cancer starts. Then the third reason is that there is a vaccine that is available to prevent the disease. So first of all, what is the cause of cervical cancer? More than 90%, up to 99% of the cervical cancers that we see are caused by the infection of a virus called the human papilloma virus, or HPV virus. This is a virus that is contracted sexually. It is a highly infective virus that usually infects people within the first few sexual intercourse, between the first contact with sex, both men and women. It is highly contagious. In some people, the body is able to get rid of the virus, but with some people, the virus remains in the body. It now causes changes in the cervix of a woman that can now lead to the cervical cancer. There are different strains of the HPV virus, but you have the high-risk strains and you have the low-risk strains. The high-risk strains are the ones that lead to cancer, and you have the low ones that cause other things like genital warts. So that's the cause of more than 99% of cases of cervical cancer. Now, when the second aspect of it having a precancerous stage, when this human papilloma virus remains in the body, it causes some changes into the cervix. The cervix, just to explain more, the cervix is the bottom part of the uterus of a woman. Now, it undergoes a lot of changes. Women have babies and so on. But with the presence of that HPV virus, those changes can turn into cancerous cells over a few years. This can last for a long time, up to 15, 20 years, before those changes even turn into a cancer. So at that stage, if a woman is screened, those cells can be detected and the woman can be treated immediately, which means you have eliminated the chances of the woman having the cancer in the future. The third thing is there is the availability of the HPV vaccine. This vaccine has been available for over 2 decades, for over 19 years. The vaccine has been in use. Hundreds and millions of people, girls, have gotten this vaccine. There is enough evidence to show the safety of this vaccine and its effectiveness. So the presence of all these three things make cervical cancer, a very preventable problem.
Okay, now I like that, because that's a very nice starting point. And for those who are running away from the vaccine, it came out the year my children were of the age, and they have had it ever since. So please, take the vaccine. Let your children take the vaccine. I am begging. It saves lives. I have cancer. It's not worth it. Next question. What are the most effective prevention strategies, other than what you've explained, that are currently available? So you've explained how we get it and the process, but what are the strategies now that are going to help us to move forward?
Okay, so prevention, two main things: the screening aspect, and the screening means that you are looking at women who might have got infected by the HPV, and they may be having signs that the cancer, the cervix is undergoing malignant changes or precancerous changes. Then the second thing is the vaccination. The screening aspect of the prevention is one of the most effective ways of prevention of cervical cancer. In advanced countries where they have national screening programs, the incidence of cervical cancer is extremely low. But for us in our country, where we do not have a national screening program, which is about to change now with the work that the NTF is doing, we are having high numbers of cervical cancer cases. Now, there are different methods of screening. The most, you have also, so we can break it down into the types. You have the ones that we do by cytology. There's what we call the pap smear. That's one of the oldest forms of cervical cancer screening. It involves taking samples from the cervix, examining it under the microscope, and for changes that suggest that there are precancerous changes going on. And it is, when you get the results, it grades the degree of the changes, which helps the physician decide what kind of treatment is required for that woman to treat her problem, or to even, because if you screen, it could be negative, it could be positive. The idea is you are screening to detect whether it is positive, and you can deal with it immediately. So a pap smear is one of it. You can have the HPV testing. Now, this is one of the most reliable tests that you can have, where you detect whether the woman actually has the HPV virus in her system. The screening with the pap smear detects whether there are changes that might have occurred because of HPV infection. But the HPV testing tells the woman that she actually has HPV, which puts her at risk of getting cervical cancer. So when you have tested that, you are able to know how to treat that woman to prevent her from getting the cervical cancer. Now, these two methods are capital intensive, in the sense that with the pap smear, you have to do it by a specialist. You have to have a pathologist to read those slides. So it is technical. We need the personnel to do that, and because of that, it is expensive for people to actually access it. And it is only accessible in centers like the teaching hospitals and some general hospitals. You don't get it at the primary healthcare levels in rural areas, for example. The same thing with the HPV testing. That one is not readily available because it is also expensive, considering it is a relatively new screening technique compared to the pap smear that has been around for years. It also is quite expensive and not readily available in Nigeria, but it is available. Then the third one is the one that it's like a compromise that is being used, which is called visual inspection. Visual inspection with acetic acid, VIA. This is the one that is being deployed in the primary healthcare setting, where our health workers are trained to examine the cervix in a particular way that would tell us that there is a problem with the cervix that is showing some precancerous stages in that cervix, and you are able to now go ahead, and there's an algorithm that you use to treat those kind of women. So those are the three screening methods that are available, and they're all available in Nigeria, and women can actually access that to be able to prevent themselves from catching cervical cancer.
Now, when I think about this, that makes a lot of sense, because these screening methods, for as long as they are available in Nigeria, then we should be trying to work out how to ensure people get screened early. And the challenge we'll all accept is finance. But if you say some of it are available in the primary health sector, that should be funded, I presume. But okay, let's go to the next question. Many women may not know about the HPV, which we agree, and which we've struggled with over the last year, and we've made significant progress with it. How accessible, which is the question I was going for, is it now in Nigeria, especially with the age group that is ideal for? We've started it in Nigeria, I think 11-year-olds or 9-year-olds, I can't remember.
You're talking about the vaccination.
Vaccine now, yeah.
All right.
Because that's the key. Prevention is better than cure. We don't want to get to the last bus stop.
Yeah. So, so just to go back a little bit, the strategy, there is actually a World Health Organization, WHO strategy in trying to eliminate cervical cancer by the year 2030, if that is possible. And the strategies for that is to ensure that you have 90% of girls being screened, being vaccinated from against HPV. You have the women who women to be screened, and then you have the women who actually have the cancer to be treated. By the time you have all those three things done, you are able to eliminate cervical cancer. Now, vaccination is targeted at young girls and even boys, actually. We'll get to that, but it's for both boys and girls. The logistics of providing vaccinations for both boys and girls is what prevents concentration on the boys. Since boys are not affected by cervical cancer, it is concentrated on girls until we have the resources to be able to give boys. I needed to say that.
Okay.
So the aim is to ensure that girls that have not yet become sexually active between the ages of 9 and 14 are vaccinated against HPV, because a lot of people actually get infected by HPV within the first sexual contact that they have. So if you are able to get girls by the age that they are 9 to 14, when they haven't started having sex, that is the best time to get the vaccine done. Now, the vaccine, to just explain so that people can understand, the vaccine is created using a harmless aspect of the virus itself. It is injected into the body to create a reaction that produces antibodies, which are like soldiers that protects the body from infection when it actually occurs. So if you give a girl the vaccination, she now has the antibodies in her system. When she does become sexually active and she gets exposed, those antibodies will now go and kill off that virus and she doesn't get the infection. So whether it is a boy or a girl, that is the mechanism for having the vaccination. So you can understand why it is important that we have that vaccination. So right now, it is available in Nigeria for free because it has been integrated into the National Immunization Schedule. All girls between the ages of 9 to 14, as long as their parents give their approval, are going to can be vaccinated for free in Nigeria at the primary healthcare facilities. It is being rolled out. The rollout started in 2023, according to states. So it may not be available in some states for now, but it has been rolled out. I think the first set of states have been able to roll out their own vaccination program. It's going to be a continuous thing until all girls and all states actually have the vaccines available, but it is for free. But for older children, girls and women older than 25 years and so on, or people who are already sexually active, as long as they do not have the infection, the vaccine can still be effective for them and they can go ahead and have the vaccination. For those that do not fall within the age group of 9 to 14, there are private facilities that actually have the vaccine available, which can be bought and given. The vaccine is given in 2 doses. The first dose is given, and then a second dose is given 6 months after to boost the first dose that was given, and that should give a lifelong protection against the vaccination. I think, is that clear enough?
Yeah. I think you couldn't have made it any simpler, because I keep going back to when I recall doing this vaccine thing and what it made sense. So yes, thank you very much. I think that the viewers will get the reasons why you've done it that way. Okay, so now there are different screening methods which you started off the conversation explaining. The VIA, the pap smear, and the HPV. I know that I grew up knowing about pap smear.
That's fun.
And the pap smear, can I just divert? This pap smear thing is supposed to be done regularly, right?
Okay, yes, the pap smear is done. Every country has their own screening criteria, and also depends on the person. So if you do a pap smear once, you can repeat it within 3 to 5 years, depending on which country you are. For us in Nigeria, it's every 5 years, right? But if a woman is HIV positive, she needs to be screened more often. Because of her HIV status, she is more at risk of developing cervical cancer than a woman who doesn't have HIV. So her own screening is more often than the normal population. But if you have a pap smear and it is normal, you are going to be fine until another 5 years. If you have an abnormal pap smear, The repeat will depend on what level of abnormality is detected in you. So that one will go according to what you are dealing with.
Okay, so we're rounding off now. And I'm going to ask you the last question. Yeah. What is the biggest barrier preventing Nigerian women from going for this screening across the country as we close? Thank you. The biggest barrier for causing us not to do this thing, which is killing us.
I wouldn't say the one biggest barrier. There is multiple
barriers. What are they? Okay.
First of all is the lack of awareness and information on what cervical cancer is and and what causes it. The lack of the inadequate equipment and screening facilities that we have, and not having a national screening program, which is currently being addressed with the NTF screening committee. Then, of course, you have the issue about poverty, but then cultural and social beliefs is one of the biggest challenges that we have that prevents people from accessing these services. So that can be sorted out by people actually going out and getting the right information and awareness of what cervical cancer is, the issues around it, and understanding it. That way they can be able to overcome those barriers.
You're a gem. Thank you very much. You made it easy for me. So thank you, Dr. Bello, for sharing your expertise, your passion, I know, and your leadership on this fight against cervical cancer. Thank you. I've had the privilege of working with you. It's been an awesome experience, I cannot lie. And it made me feel useful to society for a change. So I want to say a very big thank you to you.
Thank you very much. I'm very happy to help you with that. Thank you.
Thank you. So as we close now, I'd like to just give us some quick recap. HPV causes most cervical cancers, but it's largely preventable. Everybody listen. Vaccination is available for 9 to 14-year-olds. Check out your state and get it done. And your barriers, please, let's not stigmatize. Let's come together and work together. Together we fight, together we win. Thank you, Kakaki. Thank you, AIT, for always making sure we can do this. We really appreciate you. And to our viewers, we'll look forward to seeing you again. December next month, we will start our intensive campaign on HPV, on this vaccine for January, so that we can make sure we are well and truly equipped. Have a fantastic year and month, end of the month. See you. Our message is very clear. Together we'll fight. Together we win.